And he said, for example, I want to know whether or not I'm giving 100,000 patient records to, this is what he said, some guy with a computer in his basement. And here I sit with my computer in the basement.
You're listening to the Help Me with HIPAA podcast, where HIPAA and humor collide to make learning fun. Your delightful hosts are Donna Grindle and David Sims. Relax. HIPAA help is on the way.
Welcome to the Help Me with HIPAA podcast. My name is David Sims from HIPAA for MSPs, and joining me is my co-host, Donna Grindle of Card and Compliance. And speaking of Card and Compliance, they are the sponsor of today's podcast.
Yes, we are. I'm supposed to come up with a proper sponsorship little bug, but, you know, as we do things on the fly here, come on down.
Say something clever about yourself.
That's right. So what we do at Card and Compliance is help you manage cybersecurity, privacy, formal programs that are required by HIPAA, and what now is expanding into financial and legal and other businesses as well. But somebody's got to understand all those different things and give you direction is what most people are looking for when they stumble upon us or are referred. Mostly it's referrals, and this is probably our only commercial, which is why it's so bad. So we're here to help you do the work of HIPAA.
Help me do HIPAA. No, do HIPAA for me.
I ain't going to help you do it for you.
That'll get a whole nother thing started.
Oh, yeah. You know how it is there.
So you attended because I failed to attend the...
David screwed up.
I did. I didn't read the deadline date. I did not read that properly. So I did not register in time to attend the NIST OCR Annual Conference on Safeguarding Healthcare Information. So you attended that all by your little lonesome self.
Instead of attending it with you where we could have a conversation today.
We are going to have a conversation.
Yeah, I'm going to tell you what I know again.
You would tell us everything, and I'm going to agree with you. And then, of course, we're scheduled for attendance of the HIMSS conference coming up in February, which she is making sure I don't forget.
I know. I'm staying on top of him this time so that we go to HIMSS together.
So
I don't know if that's a good idea or not.
Yeah, that should be fun. Multi-day conference in the same geographical location. That's the trouble.
Yep.
So there were quite a bit of topics that were covered in the conference. I did try to follow it online, and especially on Twitter, which was somewhat interesting. I did notice that there were some technical difficulties that were going on, but there were lots of good questions I saw coming from people. And as you mentioned earlier before we started recording, there was lots and lots of conversation around business associates. So I'm sure we have quite a bit to cover today. I don't know that we'll even touch on all of it because you have so many notes from the conference, but maybe there'll be a part 2 to this. I'm not sure, but tell us a little bit about the topics that were covered and the speakers that were there, and we'll just kind of let you dive into this, and I'll carry the rest of it.
Yeah, I'm trying to cram 2 days of information into 30 minutes. The good news is a lot of it was nerdy stuff, so I won't try to cram that in. But the conference was the NIST OCR, the National Institute for Standards and Technology, in conjunction with the Office for Civil Rights. They do an annual conference on safeguarding healthcare information. So it takes and just zeroes in on the security rule and securing information beyond just what does the security rule say. We're talking about, you know, where are we going next? What kinds of things are coming down the pipe? What are they finding in audits and investigations and all of those kind of things? So we get a lot of our information that we know is coming up is from sitting in on these types of conferences, and I'm really happy they do them via webcast because it lets me, you know, keep juggling things. But I do miss being able to go there and network and stuff. But I get a lot of information and sit right here in my office to do it. So David could have done the same thing.
Don't throw me under the bus.
You know I am. He's sending me the thing. I can't register on the day. Of course not. Anyway.
It's a webcast. Why do you have to register in advance?
So the topics were everything from, business associate liabilities and a lot of stuff about business associates and ransomware and the healthcare industry cybersecurity task force. We actually have one. The enforcement activity is definitely a big discussion. And then, of course, hearing from OCR themselves and the Office of the National Coordinator for Health Information Technology, which we always say ONC because I can't say that anyway. So we had great speakers, including the director of OCR, Jocelyn Samuels, David McGraw, the Deputy Director of Health Information Privacy, Alana Peters, the Senior Advisor for Compliance and Enforcement at OCR. Those three alone, it's just great to be able to hear them. Mm-hmm. And then there were a lot of others. We have a list of them, but it was the folks who are responsible for figuring out where we need to go and what's going on, or they're the ones that are actually gathering that information of what is happening and coming up with ideas of how we can better do our jobs to secure patient information. So it was a lot of stuff, 2 full days, and a few technical issues where I was saying bad words whenever I was like right in the middle of hearing something important, and then it would go freeze up. But they were trying, so can't get too mad at them. But they had all kinds of information. So I've just put together, I'm making notes like crazy. And so these are just random things out of my notes that I've tried to organize a little bit better so that we can talk about them. So they made a lot of interesting points about, the enforcement activity. We've talked about it multiple times. The enforcement was changing. They've made an announcement that it's changing. They've been seriously criticized for not doing more on enforcement. Mm-hmm. And they acknowledge that. And they are making changes because they understand that enforcement is necessary. But they are very resource limited because they're supposed to do the guidance. They're supposed to do the enforcement. They're supposed to do the audits. And, oh, by the way, some of that was never funded. It's just mandated, which is kind of interesting. So they did make a point about things like the Director Samuels mentioned, specifically the advocate settlement, which was the largest one in history. We talked about that, big numbers and stuff. And they were like, look, they messed up on a lot of stuff. And when you are part of a breach because you have an unencrypted laptop left in an unlocked car, what do you expect?
Right.
And it was millions of patients involved. So they really, came down on it. But the other point is, we talk about it often that these settlements, those are not fines. Those are settlements. They could fine them way more than that. Mm-hmm. And they make a point of saying, look, we're not trying to put you out of business. We want you to have enough money left to fix it, not just, write a check and walk away. So that was a big discussion about those kind of things. There was a lot of discussion about where we're going with digital IDs, because passwords are just, how many times we talk about password 1, 2, 3 and all those kind of things. and just the number of times that passwords are involved in major breaches, we've got to get beyond the concept of a password. But at the same time, if you make it inconvenient, people tend to not want to do it. Mm-hmm. So, the biometrics and all of that, but you got to have the hardware to do it. And, we talk about 2SV, 2FA, whatever you call it. There's multi-factor authentication. And 2SV is what we generally use. So it's 2 steps. I'm not getting some other kind of thing. It's just 2 different passwords. One password is one I know, and then the other password is one I get from an app or I get sent to my phone. Mm-hmm. So I'm using that phone. But it's now that's been made clear. That's 2-step verification. A 2FA is 2-factor authentication. So in that case, I might get a password and a retina scan or something like that. So you're getting into password and fingerprint, which you saw the thing where they went in and demanded everybody give them their fingerprints. What is going on? That's got to stop. But the big points that they were trying to make, and a lot of these sessions were panels of people discussing things, and there were doctors and security nerds and lawyers and all these different people that are involved in the process, or as they say, stakeholders. All these official names. But there was one of the doctors. He made a really good point. Doctors don't want to be with their head buried in the computer to treat a patient. Eye contact matters. You build a relationship with eye contact. You see a reaction with eye contact. And for many doctors, if you're actually interacting with the patient, you need that, not being buried in a computer. So having 14 layers of authentication to get through is just not a good thing. So they're looking at all kinds of different ways to address the identity issue. One that I thought was interesting is they're looking at having it where if you're clinical or whatever and you need access to this stuff, but particularly with clinical folks, that you have a one-touch like tap card thing that you just tap it on the device and it lets you in. But every so many hours, you have to do a much more complex login. So your shift starts and you log in with a complex process, multi-factor, whatever, and then for X number of hours, you use that tap card to get in.
Okay.
So it was something like you see them doing in the restaurants where they whip that card out of the little thing. So it was a lot of different stuff there. They were really banging away at the lack of specific requirements in the security rule. And, I had read just a couple of weeks ago, it was a great point that somebody made that the HIPAA security rule is a reasonable and appropriate guidance. It is not best practices. And so a lot of technical people expect best practices. Mm-hmm. It is not. So best practices is a checklist of the things. If you're doing these, you're doing the best you can do. And that's not what HIPAA does. But one of the things that we had also talked about is the cross-reference between the National Cybersecurity Framework and the HIPAA security rule. And you and I, we talked about both the CSF, the Cybersecurity Framework, as well as the cross-reference. They did a crosswalk between them. And it didn't hit me because we did talk about specifically that they made a point in the GAO report of saying that of the 98 elements of the CSF, they were only able to map HIPAA security to 19 of them. Right. You remember that? Mm-hmm. We talked about it. They made that point. Well, to put that in perspective, one of the guys was putting it in perspective in a way that we really hadn't thought about it. Wow, 19 is not a lot. He says, if your kid brings home a test score of 19, how happy are you? If you're the manager of a baseball team and your player is batting 190, how happy are you? So that was a big point, and I it really did bring it into focus a little bit more. And so, just like the GAO said, there needs to be more cross-reference or more functionality from the CSF brought into HIPAA requirements. And that's why people are starting to say they're going to have more security guidance coming in 2017. And, they really had not a lot of activity last year, but this year they've had a lot of guidance, a lot of settlements, a lot of things going on. So that's been great because we can move forward. Mm-hmm. So hopefully they'll be able to do that, continue that path next year. And, but I did hear somebody talk about, are we starting to look at HIPAA 3.0? Which I made a point. I made a note to myself, and I was like, we got tons of people that haven't acknowledged HIPAA 2.0.
That's true.
It's not that they're just not on it; it's they haven't even acknowledged it. They're still working on 1.0 and perfectly content. So
I guess next we'll have HIPAA XP.
But it's certainly a point to start to say, look, next year this is going to get harder. So the longer you wait to get this stuff done, the harder it's going to be to do it. And there was even somebody that asked a question of saying, is it time to start offering some level of funding to assist in the security and implementation stuff.
That's a good question.
Because there's just really nothing there.
Mm-hmm.
And, the OCR folks are like, the only funding we have to work with is our budget, and we can't do what we're already supposed to do.
Right.
So we're just totally at a loss of where that funding could come from. While it may be a good idea, you need to be talking to, your senators and congressmen to be able to make that happen, because they're giving mandates to OCR and saying, and oh, by the way, you're going to get this done, but we're not going to give you any money to do it. So, they're like, we got nothing. They made the point of saying all of that settlement money that they have been able to get has allowed them to fund the audit program, because it's not funded, which was kind of interesting. Well, and they also mentioned that some of the big settlements from past years, I think they were talking about the Signet settlement that was like way long ago. It wasn't a settlement. It was an actual civil money penalty that they did. It was the very first one a long time ago, and they never got a penny because Signet filed for bankruptcy. So they never got any of that money. But there's other guidance coming on social media, text messaging, sharing PHI with friends and family because of the Orlando stuff, which we did a whole episode talking about having crisis management, crisis plans, HIPAA be part of your crisis plans. So the OCR is pretty busy.
Yeah.
Is what they were trying to say, is we're pretty busy. And somebody asked one of the OCR speakers, do you have any idea about the numbers of breaches reported, this year versus last year? And it was Devin McGraw, and she turned around, she goes, it's huge. Just the reaction of her. And it was something like, she's like, the last year it was like 17,000 reports, and this year they're on track for 24,000.
Wow.
I know. But they did have, there were some quotes either from the panel or things that people had said that I did make some notice of, some specific quotes that I thought were interesting. One that we've also talked about, trust is essential in healthcare, is one of the things that Jocelyn Samuels made a point of saying, is this is a huge problem. And I tell people we're on our way to a healthcare crisis. If we want people to let us treat them to prevent high-cost medical care, they have to tell us what's happening. And if they're afraid to tell us what's happening because they can't trust us to keep it confidential, then we're only digging a deeper hole. Mm-hmm. So it is essential in healthcare. And this line, we're going to start using it here and on the podcast, because multiple people at OCR used it. Some breaches are like a canary in a mine. So it may be a small breach, but there went the canary. And for those of you who may not know that analogy, they used to take a canary into the mine. If the canary, passed out, then there wasn't enough air for the miners and they knew to get out. So there's danger in the mine if the canary falls out. But the point is, people are like, well, why are you paying more attention to these small breaches? And they were asking about it. And that's when she said, you got to realize that small breach that we decide to investigate may be an indication of a much bigger systematic problem.
Yeah, most of the time it is.
It is often. There was a discussion that security enforcement is going to require both a carrot and a stick approach. They used to just try hey, it'd be nice if you did this. And then it was, they're trying to find ways to incentivize as well as penalties and fines, the carrot and the stick. Another quote that made a note of is they were studying that whole about the digital IDs and how quick people are in and out of stuff. Mm-hmm. And by one count, the clinical staff would spend 45 seconds on an individual chart at a time. So the average time, of course, there's a lot longer and some are a lot shorter, but the average time they spend in a chart is 45 seconds at a time.
Wow.
They're looking things up and getting the information they need. They know exactly where to go to get what they need or enter what they need, and they're done. So, the long period of time, when you think about most of the interaction with the chart, is either updating information or extracting information quickly. You don't study them as often as you do update them. So I thought that was pretty interesting. And at one point, one of the OCR speakers, who is Ileana Peters, is in charge of enforcement. She is someone you would not mess with. You look and she's like, she looks nice. That initial thing of, nice looking, she just seems friendly. And then she starts talking and she gets this dark look in her eyes, and she's like, we don't like being ignored. Don't ignore us. And all of the OCR speakers made a point of saying it. So people maybe must have been trying to act like, you ain't going to do nothing to me. HIPAA schmippa. But yeah, she was like really intense about those things. And you can tell that she really takes her job seriously. And she's really trying to protect patients, because remember, their job is the Office for Civil Rights. Their job is to protect the individual and the individual's rights. And she takes it really, really seriously. So you could tell that, but that intensity in her, for me to say, ooh, that tells you right there. But, and then this is one I knew you would like, is they were talking about countermeasures to handle security incidents and ransomware and those kind of things, and they called it cybersecurity prophylaxis.
Well, yeah, I guess so.
So it's going to give us a whole new thing to go with "Stay Out of My Breeches," because when I heard it, and I was like, "Did they just say?" Yep, they did say it.
I didn't come up with that.
I know. I can't believe you didn't. A huge discussion that came up over and over. First of all, there was a panel on it, but it did come up over and over, are business associates. Mm-hmm. And, it was talking about, essentially, with business associates, we're now reaching a HIPAA 3.0 stage with business associates, because, before it's just sign, I'll sign it, whatever it is. I don't have to do anything, just sign it. And then it was, you have to accept you have liability. And now they're like, you need to be vetting these people. You need to not just use a template for your business associate agreements. They need to be specific to the relationship that you have. And you don't need to treat the BAA as an authorization for access. You need to treat it as a definition of responsibility, which I thought was very interesting. And they were talking about vetting the BAs. And, that's something you can go back to when we started the podcast. One of our early episodes was about business associates and vetting it, well over a year ago. And, so it's something we've been about from the get-go, the importance of it and all of that kind of stuff. And they said, well, we know this could seem like an onerous task when you look at all these BAs we just talked about. But they said what you need to focus on is the high-risk ones. And, a big company, if you're using Amazon S3, it doesn't require the same vetting as you're using guy down the street.
Okay.
And or a startup for something. And that you need to vet the startups and the small companies way more than you do some of the really established, been in the business associate activity from the beginning. And he said, for example, I want to know whether or not I'm giving 100,000 patient records to, this is what he said, some guy with a computer in his basement. And here I sit with my computer in the basement. I was like, don't worry, I can pass your vetting. You don't really give me 100,000 patient records, but back in the day.
So are they saying that when you're dealing with, let's just say Amazon, since you mentioned that one, if you're dealing with people like that or Google or somebody, that you shouldn't expect them to do some level of due diligence, or is it a lesser level of due diligence?
Well, generally what we tell people to do with those big companies, number one, you got to make sure you get the BAA. Okay. And if you don't have that, then you're in violation every day, times 2. So you have to have the BAA, but then once you have that, then with those big companies, almost always they're going to have white papers. It's going to be in their SLA about their security practices. You're going to have it some other way. And make sure you do have it. Make sure you evaluate it and you document it, and you don't just assume that, oh, they're good, I don't have to worry about them.
Okay.
Because you do need to, show that you did some amount of checking, that you actually made a decision that it was secure enough for you.
Okay.
So we go look and pull the security white papers and any of their how we handle HIPAA and HIPAA BAA stuff and all of that for the big companies. You should be able to find that. It shouldn't be a problem with the big companies, software companies, storage companies, whatever it is. You should be able to get that information from them. And if you can't get that information from them somewhere, red flag.
Mm-hmm.
But it's there for most of the big ones that you would know about. It's the startups where you have to ask them for it and pressure them for it. And then, of course, the small businesses that you have to watch out for.
Okay.
So, and they made the point, which is another thing that we talk about when we do a class that's specifically on managing business associates. And one of the things that we bring up is you should be negotiating that BAA first.
Right.
You should be getting your BAA worked out and doing your vetting before you negotiate a contract with them. That shouldn't be last. That should be first. Because you don't want to spend all that time negotiating these dollars and cents and all this other stuff only to find out you can't work out a BAA, or they don't actually do the security work. They tell you it's none of your business what their security plans are. And then, another point that they brought up, and this relates back to some guidance that came out about cloud computing, as well as some guidance on business associates, is you need to evaluate CIA when you're dealing with your BAAs. Not just their security, but their understanding of the CIA requirements. So confidentiality, integrity, that's a lot of people, but availability, we talked about that in our ransomware episode, that if the PHI is not available, that's a breach as well.
Yeah.
And that's what happens.
Here's a question. To what extent does the PHI have to be unavailable before it starts, sounding bells and whistles for compliance aspects?
Well, basically, their point was if you have a ransomware attack that takes anything that contains PHI and encrypts it where you can't get to it, at that point, you have a breach.
So what if you have another scenario, because you just mentioned how a lot of these CEs are moving to the cloud. Let's say you have an outage, whether it's some piece of equipment or a server goes down or whatever, and they can't get to that data for 8 hours, 24 hours, whatever. Is that also considered a breach, or at what point does that availability kick in?
Well, that's part of what you should do in your risk assessment of using the cloud vendor, is that if we're going to go to the cloud, then do we have redundant internet access? And if both of those go down or the cloud vendor goes down, what is our plan B? And are we willing to take that risk? So you and I both use Google G Suite is what it's being called now. And they have a service level agreement rather, that says they're promising us like 98, 99% uptime.
Right.
So that's what you look for in saying, okay, well, that's an acceptable risk for my business to count on your service. So then the next question is, can I maintain an internet connection? And hopefully I live in a big enough place to have more than one internet provider, unlike David, so that I can have redundancy. But you make that part of your risk assessment when you decide to go to the cloud. And then that's just a normal DRBC kind of situation. That's not a breach. What it's talking about is if a business associate decides to cut you off because you haven't paid a bill, they're in violation of HIPAA.
Nice.
Yeah. So, and I tried to get a question in on Twitter of, what if they give you read-only access? And I couldn't get an answer to that. So we'll have to ask it some other way. But overall, the point they make is if they have your PHI and you can't get access to it, and they are preventing you from getting access to it for whatever reason, then they're holding you hostage, and that is a violation of HIPAA by the business associate. And that's another reason to look into it. So if they get hit by ransomware because they didn't have strong security practices or they have a breach, have you done enough assessment of their practices to feel comfortable you can trust them? So BAs, you need to be out there. And they talked about, at some point, you're going to reach a point with a business associate where you're going to need to say, what did you know and when did you know it?
Yeah.
Yeah. And you just have to expect that was another thing is breaches are a cost of doing business.
Yeah.
Period. And you have to expect that's going to happen. So you have to plan for breaches to occur and you to be notified and the business associate to have them. And you want to know that they have a plan to do that. And if you at least do some sort of vetting, and they said you don't have to go in there and turn over every rock, but you also can't say it's not my problem.
Right.
You got to find a middle ground, and that's what we've always kind of taught people to do is find that middle ground. I don't need to give you 800 questions to answer, but I can give you 50. And it shouldn't be unreasonable for you to prove to me that you've got some level of concern. And another one that cracked me up is one of the lawyers was like, if they just hand over their risk analysis, that's a concern. You and I have talked about this is a highly confidential document.
Yeah.
And people want us to just send them to them in their email. And we're like, no, not going to do it. Here it is on ShareFile. Once we kind of started getting a lot of information in our reports for HIPAA, we started looking at it, and I was like, they can't do this in an email. Don't be emailing me this. So everybody gets a little ShareFile folder, and that's what they do. But the big discussion on Business Associate was so broad, it even included BAs overseas, and people ask me about those all the time. If you have a vendor, one of the things you need to ask them is, where are you going to house my data if you got my data? Is it going to be in the UK? Is it going to be in Canada? Is it going to be in India? Where's my data going to go? Where does it live? Mm-hmm. And if you don't ask those questions, your data could be out of touch for a long time and you wouldn't have any control over it.
Right.
So you need to make sure you know. And I've always just kind of said I would stay away from it. There's no true law that says you can't do it. Mm-hmm. But it does complicate things because how are you ever going to enforce HIPAA? And one of the lawyers made a point, it's more complex than that. You have to understand the law in that country because that's where you have to sue them if anything happens. And there's a country that he said that shall remain nameless. I was like, I didn't even think about this stuff before, But he said this one country, it takes 30 years to go to court.
Oh my gosh.
And then even if you go to court, the money that you're awarded can't leave the country.
Okay.
So when you say you got to really know where it's going and what the laws of that country are for you to be able to have any kind of response if they do anything wrong with your data or hold it hostage.
Wow.
Yeah. So I'm going to stick with, I recommend you don't do it.
So clearly there's a lot of work to be done for business associates and vetting them and getting the right concerns responded to.
Mm-hmm. Indeed.
So what about the ransomware? I'm interested in hearing this because, we just recently had the ransomware information come down where they gave us a little bit of guidance on it. So what were some of the things said about that?
Well, several discussions. A lot of people were surprised that it came out that we consider it a breach. They were like, we were kind of shocked by that and how complicated that's going to make things. But their point was, you have lost the availability. And the other question is that ransomware dropping off keyloggers? Is that ransomware dropping off backdoors? Nobody knows. So you've got to show you've actually gotten those people out of your system, not just that you were able to restore your file and get back to it.
All right.
So I thought, we haven't really talked about what else could be dropping off in that ransomware attack. It's like, hey, look over here. It's like the magician, and it could be looked over there. And they made a big point of saying, you better have a plan.
Yeah.
So if you don't have a plan, you're going to be in big trouble. You need to know because you got to act. And guess what? All the people recommended, number one, unplug that machine.
Yeah, same thing we tell them.
Yeah, unplug that machine. I'm like, check. And then it said, get your response plan out. And the first thing should be contact law enforcement, because the FBI and the Secret Service want to know when these are happening so they can track them. And that's a big discussion in the cyber world right now across the board, is information sharing, because nobody wants to tell you about their vulnerabilities. Nobody wants to say, oh, by the way, this horrible thing happened to me and here's how it happened. But at the same time, if we're not sharing it, we can't prevent others from having the same problem.
Mm-hmm.
So they were saying we need a cyber neighborhood watch.
That's a good thing.
Yeah. There was a weird car driving around today. It didn't do anything, but we saw it and it looked weird, so those phishing things and all of that.
Yeah.
And you know how you mentioned about stuff running in the web browsers, it's malvertising.
Mm-hmm. Yep.
They talked about that. And then they talked about ransomware on mobile devices.
Oh.
Where smartphones, you just look at your phone and you have a lock screen that says, until you pay your ransom, you can't get in. Mm-hmm.
Alrighty.
Yeah. And there's some other ransomware that's taking over the whole computer, not just data. It's locking the whole computer and getting into like rootkits and stuff. So there's some pretty complicated stuff. I just grabbed an article where somebody's offering some freeware to help you turn off whatever it is that lets them run those things, kind of like we do with CryptoLocker.
Yeah. I mean,
so I got to look into that. I just saw it yesterday. So
yeah, I mean, you definitely going to have to be proactive with security, and it can't be the same security protocols that you followed even a year ago. These people that run businesses and they're, they kind of ignore the layers of security. We talk about that from time to time, how you have to have layers of security. You can't just throw in an antivirus and that's it. I mean, you need to have it to where they have to jump through multiple hoops, cross several different barbed wire fences before they can get into your data. And so you have to plan for that. Don't always pick the free antivirus or the cheap route. I mean, you really have to be astute in what you're doing and how you're doing it.
Oh, and that's their point, is you need to evaluate all these devices. And a big discussion in the ransomware discussion was, how do you secure medical devices? Because they're a major problem. Mm-hmm. When we talked about, the MedJack stuff that they found, and they're able to worm their way around and attack, and ransomware issues get launched from these devices. And that was absolutely terrifying, because we've talked about the security of medical devices. It's even worse when you hear them really giving numbers. It's kind of like the realization of you scored a 19 on a test.
Yeah.
When somebody said there's only 5% of medical devices have the ability to be encrypted.
Whew.
I know.
Have the ability to be encrypted.
Yeah. And when you buy these medical devices, you better be asking how long they're going to be supported and patched, because they're still selling stuff that comes with XP and 7, which 7's in extended support. So if you buy something today, it's already headed out of being able to be patched properly. So you got to ask these questions. But then one of the large organizations were talking about, okay, we decided we're going to track down all of our medical devices. So they identified 6,000 medical devices. 4,000 were connected to the network. 400 different models of medical devices by 100 different vendors.
Wow.
And I think I've got those numbers down. You're trying to write it when everybody's saying it. So if I got it wrong, don't yell at me. But it's pretty close. And but it makes sense when you look at that, just how much trouble you have in securing the medical devices. And how these criminals work. As soon as you start beating them on the desktops, they're going to find those things.
Mm-hmm. Yep.
So those were the big security things, the ability to have digital IDs, finding new ways for IDs, business associate concerns, and all over the place, ransomware kept coming up.
So did they talk about the Internet of Things any? Because, this kind of goes into some of that as far as the medical devices, because we've certainly seen companies being hacked through air conditioning equipment, and there's so many things now. It seems like every day you turn a TV on, there's something else that'll connect to the internet. My my TV will, my microwave will, my refrigerator will, even vacuum cleaners are connected to the internet.
I know, it's ridiculous. And yes, there were several discussions that included the Internet of Things and how they're going to become a bigger and bigger issue. And, these cybersecurity task force, that's their job, is try to figure it out. And frankly, I don't want to be on those task force. I don't know about you, because that stuff is crazy. I don't even know how to go about tracking the stuff down, because the point several people made, especially like the medical devices and the IoT, security is not even on their list until they're ready to deploy.
Wow.
So I think that we can do another episode that covers the OCR specifics on audits and their settlements and their findings in their investigations.
Okay. Because
this is a good point to move it on, to cut it. Because I knew we weren't going to get through 2 full days of stuff in 30 minutes. So.
Well, we tried.
Made a good shot. We got through the nerdy stuff.
Yeah. Well, it sounds like there's a really, not just a lot of information, but a lot of comprehensive information around some of the questions that, people have been having about what they should do, what they shouldn't do. How does OCR view certain things? So sounds like it's a pretty good investment of your time.
Yes, it was. Yes, it was. I love this conference and the HIPAA Summit, both of them. I feel like I get so much information. It's very well worth my time. And I've got to, HIMSS has so much. I get overwhelmed and I can't decide what to go to. So I've got to do better this year, because I get, the ADD kicks in big time when there's too many.
All right. So very good. So thanks for going to that in your basement. Then coming back with all the information.
Yeah.
So that is our show for today, folks. We want to thank you for listening. If you enjoyed this show, we ask that you head on over to iTunes and review us. You can also share this out on your favorite social media. And don't forget, we have some openings for sponsorships. So we're looking at doing that here in the very near future. So if you're interested in sponsoring this podcast, and reach out to us. Our website is helpmewithhipaa.com. You can leave a question right there on our homepage, and we may even feature that in a future podcast episode. Anything else, Donna?
I am set.
You good to go?
I'm good to go, at least for today.
All right, great. All right, so remember, HIPAA is not about compliance. It's about patient care.
You've been listening to the Help Me with HIPAA podcast, hosted by Donna Grindle and David Sims. The show created to help you with HIPAA. For more information or to ask us a question, visit our website at helpmewithhipaa.com. Neither Donna Grindle or David Sims are attorneys, and they do not offer binding legal advice concerning regulatory compliance. The information in this podcast should not be relied upon or construed as legal advice in any way. Consult your attorney for legal advice concerning compliance with HIPAA regulations.